All right, welcome back. Sorry about that short broadcast disruption. We are experiencing some internet issues, but we are still at the L5-S1 and getting it done. Our patient is doing well. And he's a challenging case from the standpoint of sedation, but we're working it out. We're almost done with this disc. You can see the end plates. And this is all herniation, by the way. The blue stuff coming up. Let me know when you're ready. Seems to be settling down a bit. Yeah? Yes. Proceed? Yeah, it's definitely an area that's very sensitive for him on this disc. Clearly a painful area. They want what?
I want to make sure he's very tight.
These are all herniations coming out.
It's good? Okay.
What are you worried about? The straps?
No, I just want to make sure the straps are good. Thank you.
I'm almost done stimulating him, Dr. Berndes.
Okay.
Just another minute, and then I'll be done stimulating. Then we'll go on to the next disc. He's very sensitive to pain, obviously. Yeah. Any questions from the audience?
No current questions.
Thanks. Now we've already run the video showing why do disc herniations cause so much back pain, right? That video for the audience.
Copy
Let
that.
them see that. And then we'll move on to, after that, how does the Deuk laser disc repair work?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. We're just getting ready to move from the L5-S1 disc over to the L4-L5. Everything okay? Mm-hmm. All right, let's go ahead and I think we're done here. We're done with the 5-1. Always the hardest to fix. I've gotten all the pieces of herniation I can. Good. I'll just show you guys the nerve root. Should be right here. And you can kind of almost see it in that fat. But there's still a little bit of fat there. All right, we're done with this one. We're going to move up to the next disc, which is going to be the L4-5. First, we're going to clean out this area with a little betadine. Then we're going to bring the scope in and use the fluoroscope to navigate to the next disc. Because we're doing a left 5-1 bilateral 4-5, that's really counts as three discs. We call it 3 because there's 3 areas we're fixing, 3 tears. But it's on 2 discs, but since one of them is bilateral, we consider it, 3 different areas that we're treating because it takes 3 times the work. And let's get that fluoro in. Any questions?
No current questions.
All right, so I'm just checking with my team. We're going to do these next bilateral 4-5, and we're going to do the DPR 4-5-5-1 right side. Yes. Then we're going to bring Patel in to do the DPR on the SI. Yes, good. All right. Take. Let's run our video showing the audience how does the Deuk laser disc repair work.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Okay, we're placing the dilator in the second disc we're fixing, which is the L4-5. Shot. Take the guide wire out. Okay, we are in the L4-5 disc, and now we're going to bring, hold on, the tube that we're going to do the surgery with over the dilator so that we can safely place it. Shot. Sometimes the dilator will push out just as you're putting the tube in, and you've got to stop and replant it, because if you don't, you're going to have a problem. Shot. That looks good. All right, get the fluoro out. We are in position to start our second Deuk laser disc repair. You all see the hardware, right? The screws and rods there at 3-4. Useless. Didn't even help them. I didn't put it in. Somebody else did. But that's what surgeons are recommending left and right to patients with back problems. Get fusion. The only thing fusion does is it makes the surgeons a lot of money. Now, I used to do a lot of fusions, and well, I made a lot of money. But in the end, it turns out with the laser surgery now, you don't need to do a fusion. Unfortunately, a lot of spine surgeons are still doing the fusions because,
Down there.
well, they
that's
pay
also
so much better, to be
long.
honest.
There you go. Yep. Thank you. Thank you.
No, it's all right. Huh? You can see the annular tear. You guys see the tear in the annulus right there?
Yes, we do.
The white is annulus, the blue is herniation, and you can see how the herniation is stuck inside the tear. It basically blocks the tear from healing, like you guys saw in the video earlier. What I do is I come in with the laser and I clean out that tear. There's some calcium right there. You see that? Basically the beginning of bone spurs. Turns golden color when you hit it with laser energy. It's always a sign that the herniation's been there for a long time, years. You never get calcium right away. It takes time. Everything okay? What do we need to do? Anything? All right. You can keep them lighter if you want. Huh? That's okay. You know, we'll just try to titrate him to where he's... Yeah, because right now this stuff doesn't hurt deep. It's only when I get to the surface that it really starts to hurt, because that's where most of the pain fibers are, the surface of the disc. So you can put them lighter when I'm deeper. When I'm deeper, you're lighter. When I'm lighter, superficial, you're deeper. Does that make sense? Or is that too much of a word soup?
We have a question.
Of course.
This comes from Simon on YouTube.
Simon says,
And they asked, what is the cause for a person not being able to stand up straight right away from a sitting position? In parentheses, it takes a few seconds to a minute to be able to do so. Thank you.
if I'm reading your question properly, Simon, you're asking why is it so difficult to go from sitting to standing straight? And I assume the reason is pain. So if that's the case, the answer is you either have herniated discs causing your pain or you have facet joint pain. And either one of them we can fix for you. Whether it's disc or facet, come here, we'll fix it. And then you'll be able to stand up straight. And those type of problems, unfortunately, they get worse over time if you don't get it fixed. So if you let us fix it now, you can enjoy many years of standing up straight without problems. All right, there is more tear. You can see the granulation tissue. This is the source of this patient's back pain and leg symptoms. Great question, Simon. So it's either your facet joint arthritis or disc pain. If I had to put my money, I'd put it on the disc. 80% of the time, that would be caused by discs that are painful. All right, you can see to the right here, right where the laser is, there's the end plate, which is bone. You guys see that pink bone right there? We're not here to do anything with the bone. The bone is fine, but you can see it. I'm going to circle around and get the herniation from the other side. Thank you.
We have another question.
Sure.
This comes from Severin on YouTube.
Hello, Severin. Welcome.
They asked, which spinal discs are the most complicated to navigate to? Is the patient awake during the navigation in each case?
Severin, great question. So which are the most difficult spinal discs to navigate to? The answer is always going to be cervical and thoracic. But if you're talking about lumbar, the most difficult is L5-S1, followed by L1-2 and L2-3. The reason L1-2, L2-3 are so difficult is not because of the hips or anything. It's because your kidneys are up there, and you don't want to hit the kidneys. So you have to be very careful when you're navigating at L1, 2, L2, 3. But the most challenging in the lumbar spine is L5-S1, which is the one we just finished. As a matter of fact, there's very few surgeons in the world that can do endoscopic spine surgery, and of those surgeons, they all do lumbar. They don't do cervical or thoracic. Now, the ones that do lumbar, transforaminal endoscopic, they don't do L5-S1 transforaminal. They go translaminar, meaning they go through the bone and ligaments. So they're destroying your spine to do the surgery, which is, honestly, you're not supposed to do that. So I wouldn't do that. You're making the patient worse. But they do it because they still think it's better than open surgery, which it's not. But if you're doing translaminar endoscopic, you shouldn't be doing endoscopic surgery. It's a lie. You're tricking the patients. You're being deceitful. And I wouldn't do that. The benefits of endoscopic surgery are that you're not destroying the normal spine. So if you're now doing endoscopic surgery and you're destroying the normal spine, well, then you shouldn't be doing endoscopic surgery, because just do open surgery. It's going to be safer and easier for the patient. I know that sounds complicated, but the whole point of doing endoscopic lumbar surgery is to go transforaminal, not translaminar. Everybody goes translaminar and they destroy the spine with it. So if you're going to do endoscopic, go transforaminal. If you can't do transforaminal, then you shouldn't be doing it. Send it to a surgeon who can, like me, like Deuk Spine Institute. It takes more skill, it takes better equipment, it takes better staff, better training, more experience to do transforaminal L5-S1. But that's the very best way to do it. And very few surgeons in the world are capable of doing that. Very few. Literally, probably 5 in the world that can do that.
We have a few more questions.
Sure.
This next one comes from Melissa on Facebook.
Hello, Melissa on Facebook. Welcome to our live stream at Deuk Spine.
They said, I have sciatic nerve pain. It started a few years ago with pain.
2 minutes.
With pain about every few months. Now it is almost weekly. What could be the cause of this?
Hi. The most likely cause of your sciatic pain is a herniated disc or annular tear. Basically what we're fixing right now. The disc. The second most likely cause is piriformis syndrome, spelled Piriformis. A third cause could be your facet joints. A fourth cause could be your ischial tuberosity tendonitis or hamstring problem. The only way to know is for me to see you in an examination. Usually we can figure it out with the MRI review. So feel free to do an MRI review with me for free, no charge. And I'll spend 10 minutes and I'll tell you why you're having your sciatic pain. So it's best to get the answer from me directly. Henry, will you type the link to
Already
the free
did.
MRI review? Thank you.
Of course. And,
It's free for everybody.
and we have another question.
Yeah.
This comes from JMC on YouTube.
Hello, JNC.
They ask, what are your thoughts on gabapentin for nerve pain?
Great question. What are my thoughts on gabapentin for nerve pain? So let me preface this by saying I'm a neurosurgeon. Neurosurgeons use gabapentin for things like seizures. That's what they were originally for. And then people that were getting gabapentin for seizures realized that their leg neuropathy pain got better. So doctors started prescribing it for pinched nerve symptoms, neuropathy or radiculopathy, okay? So it started out as a seizure medicine back in the 90s and became a treatment for leg pain, sciatica. I think it's a horrible treatment, worst treatment you can do. It's a bad drug, it has lots of side effects, and more importantly, sciatica and nerve pain should be treated with surgery, not medicine. Medicine will never fix it. Your body will never heal and get rid of it, ever. It's just going to stay there till the day you die. So the best thing to do is to fix it properly, okay? And the way you fix it properly is with this surgery you're watching right now. So I don't believe medications are the right way to treat pain. Medications never fix pain. They only eliminate some of the pain temporarily, and over time they have horrible side effects and they cause problems. Like your kidneys will shut down, for example, or your liver will go into failure, okay? 30 seconds. 30 seconds. So rather than taking medications for the rest of your life that will never fix your problem, I strongly recommend, yeah, you don't have to give him anything. He's fine. I strongly recommend you get your problem fixed properly. 10 seconds. And if you get it fixed with this surgery, it goes away permanently and never comes back. 5, 4, 3, 2, 1. Great question. I love the questions, by the way.
We have another question.
Sure.
This comes from, I hope I'm pronouncing this right, Illyrian Gaming.
Hello, Larry.
Illyrian said, what are your thoughts on a procedure called disc seal originated by Dr. Pauza?
Yeah, disc seal. I get a lot of disc seal questions. But more importantly, I have a lot of patients come here to Deuk Spine that had the disc seal, and it doesn't work. Disc seal is just really a play, a venture capital, sales play where they come up with something that sounds good in theory but doesn't actually work. And they sell it to investors on the stock market or private investors, make a lot of money, and then get the hell out of the product before anyone realizes it was a scam. Disc seal is a scam. My opinion, and I'm allowed to say this, it's my opinion, disc seal is a scam. We don't offer it to our patients because it doesn't work. Deuk Spine Institute is different. We don't do treatments that don't work. When we do a treatment, it works. It takes the pain away permanently from where we treat it. We do one treatment, it takes the pain away permanently. If we're fixing your L4-5 disc because it hurts and it's causing back and left leg pain, when we're done with the Deuk laser disc repair, that pain's gone forever, unless you re-herniate it, which is really hard to do, by the way. You'd have to do like some serious physical activities that I tell you not to do after surgery, right after surgery. Then you'll re-herniate. But if you don't re-herniate, the pain literally is permanently gone. We've been doing this surgery 16 years here at Deuk Spine. And our patients we did 16 years ago, 15 years ago, 14, 13, 12, 11, 10, 9, all of them had their pain gone, and it's still gone. Okay? So don't fall for gimmicks. A disc seal is a gimmick. Okay? And I'm seeing a lot of them, like robotic spine surgery, total gimmick. Mild procedure, total gimmick. Spinal cord stimulator, garbage. I mean, there's so much bad stuff out there just designed to make companies rich off of patients' misery and suffering. And I don't think that's ethical. I don't think it's right. I don't agree with it. It's shameful and wrong. and we don't offer those treatments here. We do stimulators, but it's only for people with literally horrible damaged nerves, and there's no way to fix them. There's nothing that's going to fix them. Like diabetic neuropathy, for example, severe advanced, or chronic radiculopathy, where the nerves are so badly damaged you can't fix them. We do probably 10 stimulators a year. We could do 1,000 stimulators a year and make, well, the average profit is 10,000 a case. We could make, what's 10,000 times 1,000? $1 million? Could make $1 million profit, easy, doing spinal cord stimulators. But we don't believe in them because they don't work, they don't last, and they stop working after a few months usually. And all they do is make these companies rich because we're paying $20,000 for the stimulator. Yeah. We pay $20,000 for it. It's literally like, it probably costs the company that makes it, I mean, it's like a little wire and plastic, and then a little battery with a computer. It costs them $100 to make in China, okay? They sell it to us for $20,000. So anytime you're dealing with an industry where the profit margins are so high, they are out there marketing the hell out of that product, trying to get doctors to put them in. And that's what's happening. All these people out there are getting spinal cord stimulator recommendations by their pain management doctors because the profit margin is so high. That's the highest profit margin of any surgery that I know of. And yet we won't do it because it's unethical to do things to patients that don't work and just to make money. So we don't do that. We don't do disc seal, we don't do mild, we don't do a lot of treatments that we could do that we don't do because they don't work. It's unethical. We actually have morals and values at Deuk Spine. Now, there's a lot of doctors that do it because they think it works or because they don't know it works. They have no clue how to fix people's backs or necks, so they offer it anyway as like, hey, we don't really know how to fix you, so we can just throw everything but the kitchen sink at you. And that includes the mild procedure, disc seal. Let's try it all and see what works. In reality, what's happening is they're not fixing the patients at all. And the patients are just, they're like in a meat grinder, you know, getting ground up. They're spending money, time, frustration. Many of them fall out with suicide. Their lives are destroyed by pain and the treatments that don't work or make them worse. So that's why we're here to broadcast, because we want to shed light. You know, we want to shed light.
We have a few questions.
Yeah.
This next one comes from Illyrian Gaming once more.
Hello, Illyrian.
And they asked, all my uncles had disc fusions and all have issues after this. This is why I'm afraid of doing this type of surgery. But I also heard about disc replacement. What are your thoughts on that?
Yeah, Illyrian, thank you. So, Illyrian, thanks for joining us. And you've been watching carefully. I'm sure you saw that this patient I'm operating on right now had a fusion, just like your uncle's did. And now he has pain below the fusion at L4-5 and L5-S1. We call it adjacent segment disease. Now, he says he never got better with the fusion at all. I believe him. And that means that the doctor that did the fusion did the wrong level, didn't fuse what they were supposed to. They should have done all the discs, they only did one. My point is, fusions are bad, and I don't recommend them, okay? I recommend them only once in a blue moon and only for patients that cannot do the laser. Hey guys, how's the irrigation? Working on it? Okay, good. Yeah, we need it. It's okay, no problem, just take care of it. So basically, I agree with you. Avoid fusions. Like this person, he said to me, if I met you before I had my fusion, I never would have had it done. And he's right, he shouldn't have had it done. You guys can see the screws and rods. Now he's having more surgery, okay? We don't do that to patients. We fix everything the right way the first time. As far as artificial discs go, okay, I understand why they're there. They're there because if all you can do is a fusion, then having an artificial disc where you're getting rid of a painful disc but replacing it with a metal disc that doesn't hurt, that's a great idea, right? You're preserving movement and you're not losing any motion, supposedly, in theory, and you're getting rid of the pain. That's the theory of artificial discs. But in reality, they don't work. Okay, sometimes they'll work. You'll hear some success stories. But they don't work consistently, which is why they've been out for 20 years in the United States. They've been out for 50 years the rest of the world. But the United States was one of the last countries to get artificial discs approved by the FDA back in the early 2000s, like 2001, 2000, 2001. And, you know, University of Florida, where I trained, was one of the nation's centers for doing research on approving the artificial disc, okay? So we did some of the earliest studies, and I'm going to tell you some story that you're not going to like to hear. But basically, the companies that bought the artificial discs to manufacture them and distribute them, companies like Deuk, Medtronic, Synthes, and others now, they bought the early artificial disc technology so they could mass produce them and sell them and get surgeons to put them in. Well, guess what? I was around for all the early studies looking at the safety and effectiveness of artificial discs, and the results were abysmal, horrible, disastrous. In other words, they fall out, they pop out, they stop working, they fuse when they're not supposed to fuse, and there's so many problems with them. So the way the companies do it now is they tell you, oh, this is an M6. This is like the latest, the best. It doesn't have all the problems the other discs have. Yes, they do. They still do. They may not have as many, but they still have a lot of the problems. So basically, they've been put through a lot of redesign, and in my opinion, artificial discs are totally unnecessary because we are now beyond artificial discs. We're now into endoscopic surgery where you don't need any metal at all. So I would not put an artificial disc in, my friend. Come to Deuk Spine Institute and get the Deuk laser disc repair.
How much time right here?
8 minutes. This disc is pretty badly damaged. It's pretty fragmented. 8 minutes, and then we got the DPR. All right?
We have a few more questions.
Yeah, fire away. I'm in the answering mode.
All good. This next one comes from Kevin on YouTube.
Hello, Kevin.
They said, I have Nevro HFX for PDN. It has helped me immensely. Back to work for over a year. Getting more pain now in my neck and shoulder. I was told it's just arthritis. I'm 48 years old and I work a heavy industrial job. I had several nerve injuries before that and helped expose more pain in other areas, like an onion peel exposing a new layer.
Yeah, it's true. You're right. Some people do fix one area and they get another area. As far as your pain goes, we can get rid of your pain, all of it. Okay? Because we know how to identify the source and we know how to fix it. Look at that tear right there. That is the source of the pain. So if you're having pain in your neck, they say it's arthritis, that's what we fix at Deuk Spine. I just need to figure out if it's coming from your facet or your disc, or both. And I can do that with our free MRI review. Henry, put up the free MRI review link again so that our viewers can use the free MRI review. Guys, it's a free virtual MRI review. Can't get any easier. You sit at your home or your work, you hop on a Friday, you get 15 minutes basically with me face to face. I have your MRI images because you've uploaded them or sent them to us, and I will literally show you on your MRI where the problem is and what needs to be fixed. And the reason I can do that is because I need to look at your face, I need to look at your back. I'm going to have you show me exactly where your pain is. And then I'm going to refer over to your MRI And between your MRI and your physical exam, I'm going to be able to tell you exactly where your pain's coming from, okay? Now you may say, how can you do that, doctor? You're not even touching my body. You're right, but I can do it all virtually because you're going to help me. And I do this all the time. And these people come from all over the world to have me do their surgery based on an MRI review I do online. So it's working, okay? Sometimes we get people with, you know, other areas that hurt, okay? And they got to come back and get fixed again. And that's about 10% of our patients will have some other area hurting. And they're going to come back and get a second procedure. That's because the first time we didn't identify it. There's the tear right there. You guys see the tear, Henry? Look at that thing.
Yes, we do.
And you can see the herniation stuck in there, the blue. That is the source of this patient's back pain. He's had it for 40 years. Folks, don't be like this patient. Don't wait and suffer with 40 years of back pain before you come here and we get rid of it. We literally will get rid of it in 1 hour. Everything okay, guys? You guys are blowing raspberries, or is that the patient? Huh? What? Are you talking to me? No. Okay. Well, we can't make these too easy for you, Dr. Berndes. You know?
We have a few more questions.
Your arms are tired? Well, see, you don't need to go to the gym tonight. Right? You need to switch out and get somebody else? Oh, here she comes. The woman of the hour. Just watch out for the floral. All right. Yes, I will take your questions. We are almost done. 2 more minutes. And then we're going to go to the DPR, which should be pretty quick.
These next 2 questions. This first one comes from Oz on YouTube.
Oz, welcome back, Oz. It's been a week or 2?
I would
Maybe
say
longer?
Maybe a little bit longer.
It's good to hear from you.
Of course. They ask, can facetogenic symptoms like facet hyperopathy,
Yes.
hyperopathy or symptomatic arthritis can lead to a fusion surgery?
Yes, great question, Oz. Gosh, you guys' questions are getting more and more intelligent, like maximally intelligent. You are correct. When some patient goes in and says, oh, my back hurts, and the doctor gets an MRI and sees a slippage, even though it may be facet pain, facetogenic pain, the doctor doesn't know that. He just recommends, or she just recommends fusion, laminectomy and fusion. So yes, facetogenic symptoms all the time result in fusion. As a matter of fact, I used to be one of those doctors doing fusions for facet pain. And that was before we did the Deuk plasma rhizotomy procedure. 2 minutes actually now. All right, so what would happen is a patient would come in at Deuk Spine. They had back pain. We suspected it was facet. We did a diagnostic medial branch block, took the pain away. Dr. Patel did a radiofrequency ablation, got rid of their pain temporarily, but the pain comes back. Well, now they have recurrent facet pain, and they can't have another RFA for another 6 months or a year. Their insurance won't pay for it. So what they do is we talk to them and say, look, you're having facet pain. It's going to keep coming back for years and years and years. You might as well have a fusion done and get rid of it. And they would do it. They do the fusion. I would do the fusion on them. And guess what? Their pain went away. So fusion will work for facet pain, but it's overkill. Because here's the other problem. Fusion will fix facet pain, but it'll make the facets above and below the fusion hurt more. So the patient will be back for more surgery. It's just a never-ending cycle. That's the problem with fusion. All right, 30 seconds. Almost done. Things are looking good. How is our patient doing? I got to do the DPR, so we should call him. Yes, soon. Probably in a minute. Hey, Henry, will you tell Tabitha if she could make me a fresh pot of coffee, please? Do you mind?
Sam and I had a conversation for a second.
Oh, yeah. Tabitha, coffee.
Tabitha, copy. Copy that.
Thank you. 10 seconds. Just about done. I love it. All done. The nerve is up there somewhere. Actually, let me get this right here. This is the last bit of herniation. It's sitting underneath the nerve. A lot of inflammation. No, we're done. Okay. All done. Lay still, you're doing great. We still have to do the DPR. You know, I think the greatest bit of evidence that discs do hurt is that right there. Right? I'm literally lasering just the final fibers on the outside, and patients that are awake enough, they feel it. And it hurts. It's highly localized pain, you know what I mean? So it's amazing that doctors can ignore the fact that disc pain is so localized, so specific, you know? They call not pain non-specific. It's not non-specific. It's specific. They just don't know where it's coming from. We okay?
Yeah.
All right, folks, we're breaking the scope down, and next we're going to move in our fluoro, and we're going to do our facet joint treatment called the Deuk plasma rhizotomy. Bring it in, bring it in. This is an advanced rhizotomy technology developed at Deuk Spine for a permanent treatment of facet joint pain. Not like the RFA, where you keep coming back for more every 6 months, and it gets less and less effective. This is a one-time, you're fixed, and we're done. Take your time. Let me know when you're ready, Luis. And let's get one quick AP. Move your hands. All right, beautiful. Now, just give me a second. All right, so we've got that bottom screw. So that's a 3-4 fusion. So that bottom screw is at 4, right? Everyone agree? So you can see everything nicely. You don't really have to move very much. Let's see what you did. Sean? Yeah, I wouldn't do that. I go back to where you were. Actually, you had it all nice. Now, don't tell me you're going to have that X cross there, right? I need a needle at some point. All right, that looks pretty good. That looks pretty good. It'd be nice to see the TP at 4 on my side. I think you had it a little better before. Shot. You see it? I see 5. I don't really see 4 that well. That's 5. I don't know if that's the TP though. Is that the end plate or yeah, you're right. That is the TP. Let's go with that. Shot. Oh my God, look at that aim. I was meant to be a pain management doctor. I mean, that's bullseye, right? Look at that, bullseye, first time. Go ahead, Luis. Any questions from our audience?
Yes, we have one question. This comes from Illyrian Gaming, once more on YouTube.
Sure.
They asked, thank you so much for answering my questions from before. So what is it that you do compared to others? And also, does insurance cover what you do?
Yeah, great questions. So number one, what do I do different? I use more energy, and I have the ability to direct the energy where I want it to go, whereas the other doctors can't do that, okay? Other than that, we are patenting the technology, so I can't talk too much about it yet because, well, we're patenting it. All right, so we need a little more time. But you're watching it happen right in front of your eyes. more energy, more control in terms of navigating the tip of my probe to where it needs to go, okay? More energy, and I'm able to move it around. That's really what it comes down to. And by making those two changes to the technique, I'm able to eliminate back pain from the facet joint that other doctors could only dream about eliminating. More importantly, more importantly, here's the real problem, folks. It's staring you in the face. If you're a pain management doctor, what do you expect? You expect your patient to come back every few months for more treatment, right? And they bank on it. They bank on that, right? So they want you coming back. They want you getting more treatment for your back pain. That's how they make their money. Tell me when I can proceed. The problem is that we don't want you to come back. We want to be done with you. So we have so many patients coming here, we don't want repeat business. We want to fix you. It's just something, I don't know, medical ethics, I don't know what you want to call it. We're just weird. We want to cure pain rather than manage it. So these other doctors probably could do the same, but why cure pain when you can just have people coming back every few months getting more treatment? That's the problem. That is the crux of the issue, folks. Our back pain treatment in the United States and the world is set up to reward doctors for managing pain, not curing it. You're all right. And so we don't agree that that is the right thing for patients. Therefore, we have developed new treatments that are better than what was there before. And we did it because we want people's pain gone. We don't want them coming back. All right, let me have a num num num. You got it, Dr. B. For you, I'll do it. Just for you. Shot. 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 Doing all right? Shot? Is he okay? Hmm? All right. We're giving a little more numb. Just about done. About 1 or 2 more minutes. 2 more minutes, let's just say. Yeah.
We have another question.
Yep.
This comes from Illyrian Gaming, once more on
Shot.
YouTube.
Uh-huh.
And they ask, is this instant pain relief? If not, what's the recovery time? Sorry for all the questions, but it's my last. Thank you.
We love your questions.
Agreed.
We love your questions. The answer is yes, it's instant pain relief. Guys, gals who are watching, you're going to wake up from your procedure and you're going to sit in that recovery room for 15 minutes and wake up and you're going to realize the pain you came here is gone. It's gone. It's instant pain relief. Done. Great job, everyone. Good job, Luis. Great job. We're done. We did our DPR 4551. Patel's coming in to do the sacroiliac joint DPR. Yeah, folks, the pain relief is instant. Everybody comes in, like 90% of the patients. Okay, 50% of the patients, the pain they'll tell you in recovery is completely gone. The other 50% will say, I'm sore back there, but it's a different kind of pain. That's from the surgery. But by the next morning, 90% of the patients, they say their symptoms are completely gone. And they're not on pain medication. They're not on anesthesia. They're not on anything, just natural. The other 10%, they need about a few weeks for their symptoms to completely go away. All right, blood loss, I'm going to call 2 mil. Number 1, we did a DLDR for the disc. bilateral L4-5, left L5-S1. Correct me if I'm wrong. And number 2, we did a DPR, right L4-5 facet, L5-S1, and right SI joint, right, or patella will. All right. Well, listen, type your questions up. I'll come answer them for you. But we're done with the discs and facets. Dr. Patel is coming in to do the Deuk plasma rhizotomy for the SI joint. We don't do SI joint fusions, folks. You don't need them. If your surgeon is saying you need an SI joint fusion, come to Deuk Spine. In 15 minutes, we'll kill the pain permanently from your SI joint. Great job, everyone. Good morning, I'm Dr. Deuk Majan at the Deuk Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Deuk laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day, and I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7 millimeter quarter-inch incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Deuk laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do, because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are, pain-free for the first time in many years.
Many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Deuk, and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions. And that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All right,
life.
thank you.
This is Dr. Patel doing a right sacroiliac joint Deuk's plasma rhizotomy for this patient who has a chronic right sacroiliac joint pain. So right now I'm doing is I numb up the skin and I'm putting a cautery device to cauterize the nerves that supplies the sacroiliac joint. Picture. Sacroiliac joint is supplied by multiple nerves coming out of multiple levels. Name as L5, S1, S2, S3, S4, and it's very variable nerve supply for each individual. Some people has only 5 nerves, some people have 10, some people have 50 nerves coming out of these holes, and it's very hard to pinpoint. Picture. So I have to go around these the holes called S1, S2, S3, S4 to cauterize all the nerves. You can do traditional radio frequency ablation for the facet joint. The problem is because of the variability of the nerves, there is a very high chance that you can miss lots of nerves while you're doing a standard radio frequency ablation, because you cannot move the standard radio frequency ablation needle, because otherwise the machine will stop it. Because of the movement. So the big advantage of this plasma rhizotomy is we can move the cautery device tip in any direction to capture all the nerves that goes to sacroiliac joint. Plus this because of the high power, strong power of cautery device, you are cauterizing these nerves that's probably never gonna regrow, because they're gonna be severely damaged, and that's why we are expecting this treatment will help for the sacroiliac joint pain for the lifelong. Picture. As you see, I am moving my cautery device Bowie tip from top to bottom and side to side to capture all the nerves that you cannot do with the normal radio frequency ablation needles. Picture.
So Dr. Patel, can you tell us the difference between the Deuk plasma rhizotomy technique and the RFA technique for the SI joint, and why you would recommend the Deuk plasma rhizotomy?
So standard radio frequency ablation is, we use this needle that is only 10 millimeter active tip. And as I said, you have to put the needle where you want, and then you cannot move this needle, because otherwise the machine will stop. So having only 10 millimeter active tip, you're not covering enough area around these holes where the nerves comes out, and that makes you to miss the nerves, and you're not going to cauterize all the nerves, and that's why patient continue having sacroiliac joint pain. Plus the temperature level is very low with the standard radio frequency, so the nerves will get cauterized, but they will regenerate in about 3 to 6 months, and the pain comes back, and you have to repeat that procedure almost every 6 months to be pain free. Versus the plasma rhizotomy, higher temperature, so the nerves gets cauterized very, I would say, severely, and chances of them to regrow is almost 0%. And And as I say, you can move the cautery device to cover all the areas or the sacrum to cover all the nerves. So the results are pretty satisfactory. So far, we have done sacroiliac joint plasma rhizotomy. We have 100% success rate. The patient has 0 pain.
That's what I was going to ask you next, Dr. Patel, is what has been your experience with the Deuk plasma rhizotomy and the SI joints with the results? How are the patients done?
For all the patients we have done so far, we have seen them post-op day 1 and at least 2 weeks to 4 weeks so far, and so far they are all 100% better. Picture. Picture. Last one. Picture. 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 Right now what I'm doing is I'm also cauterizing something, the nerve called middle cluneal nerve, and that's also known to be responsible for the transmitting the SI joint pain. So that's another significant advantage to do this technique. All right.
Yeah.
All done. Thank you.
Thank you.